as usual, I'd like to start by introducing myself. I'm Christine Jacobs. I have the distinct honor of being the volunteer executive director of Represent PA. We are the PAC in Pennsylvania that is exclusively dedicated to electing powerful, pro-choice, progressive women to Harrisburg, both in the House and the Senate. And as I said, without having an impact in those chambers, we can't have an impact in the Commonwealth and change the things that we all know are important. And we're pleased to today be talking about Pennsylvania's mental health crisis. And we'll talk about what is the crisis, how does it exist, what we'd like to see from our legislature, and then we'll have the Senator Maria Collett talk about what she's working on and what she would like to be able to do through her caucus. But first, I'd like to tell you a story. You know, I don't think I talk often enough about the impact of our work. You know, we've created a network of women legislators who like to get things done. We're not helping to elect women who want to just go sit there and say, hey, I got a big job, I got a pension, I got health care, I get a per diem for going to Harrisburg, isn't my life wonderful? We like to elect women who get things done. They have a motive for deciding to give up their lives to do this. And here's an example. And when I first heard about this, I thought, well, this is kind of small, but then I realized it is one of those issues that that somebody cared about. One of our legislators, two of our legislators decided this would be an issue that they wanted to do. And whenever I say this to people, I get the drop jaw. Did you know that it's currently legal in Pennsylvania for doctors to perform pelvic, rectal, and prostate exams without your permission while you're anesthetized? So you could be going in to give, you know, have a hernia operation, something else, and doctors will use your body for training without your permission. Two of our legislators that we helped elect in 2018, Liz Fiedler of Philadelphia and Liz Hanbidge of Montgomery County, have put their efforts behind HB 507, which requires informed consent. Makes sense, seems obvious, but it took somebody who was willing to go to bat to talk about this subject. I've heard that it's hysterical listening to the attorney Liz Hanbidge go after some men about why they don't want to, why this law is important. I'll leave that for another conversation. But it passed the House, but like over 100 bills, it was sitting in the Senate and was not getting action. So here we had a powerful group in the House saying this should be done. No one says, hey, you know, I'm fully in favor of random procedures that you don't have to give permission for. They just didn't feel like handling it. And it went to the Senate Health Committee. Senator Katie Muth was scheduled as the prime supporter, but she was unable to be there with the day that it was being brought up. So Senator Collett, who I'm going to tell a story about you right now, because I heard this from Rep. Fiedler. She said that you gave such an impassioned speech about why this is important and what it means to people, what it means to a woman to feel violated, that she had an exam like this while she was completely, while it was not in her control. Not only did it pass the Senate committee, which nothing ever does for us because these are Republican-led committees, but it passed unanimously. And Rep. Fiedler actually came up to me and called me and said that one of the women Republican senators came to her after this discussion and said, when Senator Collett was talking, she said, I was in tears because I could not believe that we had a law that allowed this. And I'm so impressed that we made this an issue and that Senator Collett was willing to go out and make an impassioned plea. So that's my introduction. That's my just telling you that, you know, we're working on all kinds of issues around the Commonwealth of Pennsylvania. But Rep. Fiedler said this would not have gotten done if it wasn't for Represent, because she looked around at the people who are co-sponsors of this. She looked around at the folks who are pushing to get it done, and they're all women that Represent has supported. So now we're going to get into the discussion that you all signed up for, and that's that we have a mental health crisis in Pennsylvania. You know, we have a lot of people who are still uninsured, and a lot of insurance doesn't even cover mental health care. And we have a number of people with substance use disorder and hundreds of thousands of people who may not be able to get the coverage that they need. If you were on early, Gail called in and she's got a daughter who's suffering from schizophrenia. So this is an impassioned issue for her. And these are things that we care about, and we care about our people. By the way, when you talk about mental health care, it's amazing that when we had the shooter destruction in Maine, the first thing, not only are some of the Republicans calling for thoughts and prayers, but they're also saying, well, it's a mental health problem, but they're not advocating money for mental health care. And that's what we want to do today. We're pleased to have two people, the previously mentioned Senator Maria Collett, who we've worked with on a number of issues. Maria started her career as an attorney, decided she wanted to be a nurse, and then decided she wanted to combine all of that work together in changing the laws in Pennsylvania. And we're so proud that she's a fan of ours, and just like we're a fan of hers. And we're also pleased to have Christine Michaels on. Chris is the CEO of NAMI, which is the National Alliance of Mental Illness, and she's the CEO of the Pennsylvania chapter of this. And this area and the discussions around community mental health service have been her lifelong passion and her support. And I take it away, Chris. We look forward to hearing what you have to tell us about what's going on in this area in Pennsylvania.
Thank you. It's a bad habit of mine.
All of us have had that happen.
So I wanted to start out by thanking you for having us. This is sort of an exciting meeting for us, not what we thought it was going to be. So, and I also want to acknowledge from the very beginning that Senator Collett is someone that we consider a mental health champion in the Senate, which is very important for us. Okay. To have someone in both houses being a mental health champion, that we can identify somebody is very significant. NAMI stands for the National Alliance on Mental Illness. There is a national organization, NAMI Keystone. We are the state organization for NAMI in Pennsylvania. We have right now we have 28 affiliates, 25 active. And we have a membership of over 1,200 people, 1,200 members, but we also have thousands of supporters. And in any given year, we touch between 50,000 and 60,000 people with our activities, our action alerts, and various helplines that the different NAMIs operate. And the affiliates, the NAMI affiliates, a lot of them have paid staff. Some of them are all volunteer, but they're very active, and they provide education classes and primarily support. You could see our mission, and we are grassroots. We are nonprofit, 501c3 incorporated. And grassroots meaning we work for the benefit of all, for the mental health system and all the families and consumers who receive mental health services. It's not individual, although we will do individual advocacy back here, and we're located in Pittsburgh. So and we were a regional affiliate before we became the state office. So we still have obligations and responsibilities to the southwestern Pennsylvania. Beyond the state. But our mission simply is support, education, and advocacy. And because of the nature of today's meeting, we're not going to talk a lot about the support and education. We're going to talk about our advocacy activities. And I mentioned that we do individual advocacy, but primarily we do public policy advocacy. And that's either in Harrisburg or with the federal government. So in terms of the crisis in the mental health system today, there is one. And sometimes it's people just look at us when we tell them that there's a crisis in mental health because of coming out of the pandemic. Everybody thought there was going to be a crisis in mental health, a pandemic of mental health needs, so to speak, but they didn't fund it. Okay, they didn't fund it like they were anticipating a crisis, and they didn't fund it before the pandemic. We haven't seen an increase in funding in Pennsylvania since I believe like 2008 or 9, and we took a major cut in 2011, fiscal year 11-12, of 10% across the board in mental health services. That has never been replaced, never. And occasionally we'll get new money for a new service, but we also have gotten new services with no money. So it's a real it's always our primary advocacy issue is always funding mental health services. In terms of the workforce shortage, this is a shame that this even happened, because the Providers Association in Pennsylvania was bringing it to the General Assembly a good 7 or 8 years ago. Heavy. It was their primary, prior to the pandemic, it was their primary advocacy issue every year at budget time. There was provider rates, provider shortages, and nothing was ever done. Not to be disrespectful to the General Assembly, but simply lip service. That was it. That was all we ever got, sympathy and lip service, but no movement, no funding to address the workforce shortage. And when I say workforce shortage, I'm talking about key positions, therapy positions, doctor positions, physicians. The Southwestern Pennsylvania has been on the map in terms of the country, in terms of children's psychiatrist services. Psychiatrists for 10, 15 years. So it's not unreasonable or, far-stretched to consider that right now we have a major crisis in children's services, and we have parents with children waiting up to 18 months for an appointment, for an intake, because they don't have doctors. So this is, I recently spoke at a rally in Harrisburg that was brought by consumers and family members, and we represent both, but we're primarily known as the voice of families, and we represent families because nobody else does. The consumers have the Consumer Association, and they're very active, and we can see where people with lived experience, peer support is being recognized. But families, not so much. Okay, families, we are regularly left out of state affairs by the General Assembly. For example, the Behavioral Health Commission that was formed last year, there was no dedicated seat to family members or NAMI, which previously here and there we would be written into House resolutions, joint commissions. There would be an actual seat for NAMI on those. So just to give you an idea of the waiting list, there are waiting lists for everything. There are waiting lists for intakes. There's waiting lists for services. There's waiting lists for residential treatment. There's waiting lists for supportive housing. No matter where you look in the mental health system in Pennsylvania, there's a waiting list. And if someone tries to tell you there isn't, I would basically say don't believe them. There are some agencies and some providers that have the ability to turn around real quick because they have an emergency type intake or an emergency type referral system in place, but those are getting maxed out. Okay, and those are far and few between. Most of them don't have the luxury of having that, or have ever had the ability to form those. There have been hospital closings, primarily out in the East. We have a number of hospital closures, specifically psychiatric hospitals, inpatient psychiatric programs closing. There have been residential programs that have had to close down, supportive employment programs all across the state. And just one thing about the hospital, which is, I already mentioned, children's children's mental health services being in crisis. And we have a problem in this state with ER boarding, emergency room boarding, where someone is taken to the hospital and they are in need of an inpatient admission, and there is no bed for them at that hospital. There could not be just maybe not a psychiatric, inpatient program there, but they could have a program, but they don't have a bed. And we have children waiting in ERs for 16, 17 a month days for a bed, for a placement. So it's pretty dire in terms of children's services. And again, I just want to stress that this was, in my mind, this all could have been avoided if the system had been adequately funded over years. So if anybody has a solution that builds in an automatic budget increase, or at least maintain it through year after year after year, it would be it would help to rebuild the mental health system. And before we're going to go to the next slide, and Nikki's going to talk about the legislative priorities that we follow and that we're involved in. But before I want to do that, I want to give a shout out to Maggie Murphy. She's the executive director of NAMI Lehigh Valley, and she's very active in the public policy advocacy. We work with her on a regular basis. So go ahead, Nikki.
Hi, everyone. So for those of you who are not on early enough, my name is Nikki Wygand, and I am the Director of Advocacy and Public Policy at NAMI Keystone, Pennsylvania. So just wanted to run through real quick some of our current legislative priorities. I also mentioned early in the call that the legislature and what's happening at the General Assembly level changes sometimes by the minute. So these are currently what I'm following very closely. Some of them have to do with funding, as Chris mentioned. It's been a while since we've seen any amount of significant funding come into the mental health system, and just a few other things that are going to kind of contribute to alleviating some of the problems that Chris discussed. So first of all, we're following what's going on with the Behavioral Health Commission funding. Chris briefly mentioned the Behavioral Health Commission. It was a task force established last year. There's $100 million appropriated through Governor Wolf's final budget in ARPA funding for the adult mental health system. So a group of stakeholders was brought together and decided where best to spend this money at. So that's currently it was in play, it was out of play. Thankfully, it's back in play. It's currently sitting in the Senate right now as part of the fiscal code. So House Bill 1300 is the bill that outlines exactly how the money will be spent. And that was the original legislation for this was House Bill 849. So all of the language was taken directly from House Bill 849 and put into 1300 as part of the fiscal code, and with House Bill 1456 being part of that being the appropriation for that $100 million. So I don't have my notes directly in front of me, and I don't want to get away from the PowerPoint because I don't know what's going to happen with my screen share. So I'm going to go from memory here, and I apologize if I mess this up. So I will say there is 37 million something, somewhere in that neighborhood, for criminal justice initiatives. So criminal justice initiatives will be mental health services while you're incarcerated, as well as transition services to get you back into the civilian world, to reduce recidivism. I always have a problem with that word. There's also programs in there for prevention. So we have a lot of specialty courts across the Commonwealth, mental health court, veterans court, drug court, things of that nature. So some of that funding will go to that as well. Other areas of expansion are services money. Chris said there hasn't been a county level increase for years and years and years. So some of that services money will be going to the counties to expand all sorts of programming. Some of that in particular is the crisis continuum, which I'll be talking about here in a second with 988. So those are your crisis services. So you're calling the suicide prevention lifeline, you're calling 988, you're calling 911, making sure we get an appropriate response out to you. So that way it's the least restrictive possible means that we're serving you. So not necessarily we're going to send you to the hospital immediately, as has been the status quo. We're gonna try to, again, serve you in the least restrictive means possible. Another chunk of that funding is going to go to the workforce crisis, which we had already talked about, and money in that includes incentive for hiring bonuses, retention bonuses, student loan repayment, things of that nature, ensuring an upward mobility for entry-level staff. A lot of times for a lot of providers, if you're coming in at entry level, there's really not a whole lot of upward mobility for you, and you kind of get stuck. And a lot of people seem to leave the human services field when that happens. So trying to prevent the workforce shortage from happening, trying to prevent people leaving en masse. So those are some of the things that the Behavioral Health Commission funding covers. Also on the table, something we're following along closely with is 988. I briefly mentioned, the suicide prevention lifeline. 988 is the new 3-digit number. The national, if you call the 10-digit number that was previously available, you're still going to connect to all the call centers. But the federal government decided that just like physical health has a 3-digit code, mental health and behavioral health need to have a 3-digit code as well. So 988 officially launched last July. So we're sitting at just a little over a year right now. And House Bill 1305 will seek to fund 988 services, in particular the call centers. So it'll impose a 6-cent user fee for all commercial and cell phone lines, individual and commercial lines, landlines and cellular devices. And that 6-cent user fee is going to go to fund the call centers. Any monies left over will go to programming across the Commonwealth. I will mention this. 6 cents is a great start. There's a built-in mechanism within the legislation to do a percentage increase annually as time and needs allow, if you will. But that, like I said, that'll go to fund the call centers, making sure all the staff is appropriately trained, all the staffing numbers are met. I will say they're going back to the workforce issues. They've had a heck of a time retaining individuals to work at these call centers. And there's been a little bit of influx in call centers coming online and having to go offline because of workforce shortage issues. Miscellaneous bills that we're following along with. Again, these two in particular are designed to kind of help alleviate the burden of the workforce, things that are happening currently. So House Bill 1000 gives specially licensed and trained psychologists the ability to prescribe certain psychiatric medications. For some, you're still going to need to go see your psychiatrist. However, there are several other states across the country that are currently using this, and they found it to be fantastic as far as alleviating some of those workforce shortage issues. In particular for psychiatrists, Chris talked about how there's a shortage of not just child psychiatrists, but adult psychiatrists as well. And it's everywhere. There's lots of telehealth agreements in place, but still one more thing to get us across that finish line to make sure that everybody gets the mental health services in an appropriate amount of time. Also, something that we're following along is Senate Bill 25. So this will create a new level of licensure for nurse practitioners. So this will be an advanced nurse practitioner's license, and there are several focus areas that you can focus your training in, and one of those is in behavioral health. So after 3,600 hours, which I know seems like a lot, and for anybody on here who has their license in social work, you understand supervision time rather well. So after 3,600 hours of supervision time with an appropriate actual physician, these individuals, these nurse practitioners, will be able to go on and fully operate within that space that they've chosen for their focus area. I don't want to say without supervision, but previously the way it had worked is nurse practitioners had to have agreements set up with other physicians to kind of scoot the process along. But Senate Bill 25 will do away with that entirely. So. But that's all I have for this slide. I'm going to go ahead and put my email in the chat box. And if anyone has any questions about the information or like more information about these, please feel free to reach out to me.
Thank you.
Words. Chris, you want to talk about the governor's executive order? You're on mute.
There we go. Was started to say just briefly because I know we're at time. The governor just issued an executive order a few weeks ago to create a behavioral health council and advisory board, two different bodies in the state, or to establish a working plan to improve behavioral health services across the Commonwealth. And I know I'm going to sound disrespectful and ungrateful, but to me, it just echoed the Behavioral Health Commission that we still haven't seen any funding from. It was given to the people in the mental health system, the people who consume services, and families, and the Providers Association, that this Behavioral Health Commission was going to bring some immediate relief to the problem. Well, it didn't happen. So a little bit, just, I don't know how to say it, but just not real certain, but definitely I am appreciative. I don't want to sound totally unappreciative about it. It's at least a step in the right direction, and it's at least the governor who is creating it, which is maybe what we've needed. I don't know. But again, I just want to stress the family representation is lacking, even when you go through all the positions that are listed, that required to be on there. There's no family representation on the council, and maybe one on the board, on the advisory board, and that might be a stretch. So I think we're done. I just want to say that what we've talked to you about today is pretty much the essence of our advocacy program at NAMI in the state, and these are the things that we're focused on. We follow these bills, and obviously we follow the commissions and the budget and that entire process. So, and with that, we're done. So thank you.
You're not done. You're just suspending for the moment.
Okay.
I have a question for you. Somebody asked, Kathy Raphael asked, 988 calls. Who answers them? Are they mental health professionals? And is there funding for them?
Well, we had, I think, 3 call centers prior to the beginning of 988 development. I think we have 12 right now.
Yes, we're currently sitting at 12 across the Commonwealth.
Yeah, 12 across the Commonwealth. And the plan is that every county in Pennsylvania will have a call center that's responsible for them, and that 90% of the calls need to be answered in Pennsylvania, because with the suicide hotline number before, a lot of calls pinged out of state because there wasn't, people. And to answer the main question, yes, mental health professionals are answering the calls at the call centers, and they are trained. It's just not a suicide hotline number. It needs to be viewed as a mental health emergency number, just like 911.
Is it done by federal funding?
Yes and no.
A lot of SAMHSA grants, and Vibrant, who operated the old crisis line, the old suicide hotline number, is funding a lot of the call centers, because they're replacing their call centers that they had in existence. But there is, in the federal budget, there's always money proposed for crisis services. The mental health block grants that come out of SAMHSA they have a set aside. That means that there's a percentage that has to be spent on crisis. I think it might be 10%. And then there needs to be state funding
Right. Okay.
allocated to it. Yes.
Well, then onward to Senator Collett,
Okay.
because, you know, I should have said this up front. Whenever we have somebody come in and talk about the state of Pennsylvania in certain areas, we do ask our 501c3 partners to speak, because they're the ones who, on a nonpartisan basis, figure out what's going on and what is needed. And so now we turn to the very partisan part of it. And that is we have Senator Collett is going to talk about what needs to be done. Actually, she's not the very partisan. She's going to come up with the practical solutions and tell us what's going on in the legislature. And then I give you the very partisan, we need to elect more women who are going to make a change. So Senator Collett.
Thank you, Christine. I'm so thrilled to be here with all of you today. Thank you, Chris and Nikki and Maggie from NAMI. For all of the good work that you do and for giving us sort of a lay of the land. So we have a sense of where we're starting in the Commonwealth. So I am Senator Maria Collett. I represent the 12th Senate District, which is parts of Montgomery County. And as you may have seen in the chat, I am also a nurse. And I am a very dedicated mental health advocate. You know, I just wanted to give you a little statistic here that it shocked me, and so I'm hoping that it shocks all of us into realizing just how critical and important paying attention to behavioral health issues are. And you know, we know that nearly 34% of Pennsylvanians are struggling with mental illness or substance use disorder. So that's just what we know of, 34%. A third of our neighbors, friends, loved ones are, you know, struggling with mental illness and substance use disorder. So you heard a little bit from Nikki and Chris about the Behavioral Health Commission. I was really honored to have been asked by my Senate leadership to be a part of that commission. And there were, you know, professionals there ranging from criminal justice system, treatment professionals, state agencies. There were Pennsylvanians with lived experiences also serving on that commission. And we met for over 17 hours, really deliberating, as you heard, the best way to allocate that $100 million of federal ARPA funds that Governor Wolf set aside for adult behavioral health. And I really do want to stress that it was for adult behavioral health. We ultimately came up with some recommendations. You heard Nikki speak to those, where that money should best be allocated. And in order for that funding to be released, Representative Mike Schlossberg from the Lehigh Valley and myself, who served on the commission, you know, we wrote legislation that would release that funding. So basically, as you heard, it was, you know, $34 million for workforce development, $32 million for criminal justice reforms, another $34.5 million for expanding services and support. So one of the problems that we ran into when we came out of the commission's recommendations were that our Republican colleagues really didn't want to, you know, put money into the places that the commission recommended. They really wanted it to be a much more streamlined allocation. They didn't want to send money directly to counties for county service programs. And that really, you know, it was something that, you know, Representative Schlossberg and I really went back and forth on when we talked about it, because we said our counties really are the ones that have the best sense of how to get these funds to the people and organizations that can best utilize them. And so we were really disappointed to hear our Republican counterparts say that they did not want to put any money directly to county spending. So we really sort of had to come up with some other ideas. One of the other recommendations that came out of the commission that I'm really disappointed did not end up in the final bill versions was a retroactive study, $500,000 for us to look back to see if the funding that we appropriated and allocated was effective and helpful. I think one of the things we knew coming out of that commission was that $100 million certainly wasn't going to be enough to address the mental health crisis here in Pennsylvania. But we thought at the very least it would let providers know, our county partners know, and those suffering with mental illness know that, you know, we see you, we recognize that there's a problem, and if we can get this step forward, we'll at least be moving in the right direction, and we can, you know, maybe expand on this funding in the next budget. As you heard, of course, those bills have not moved. I am sorry to say that my chair, my Republican chair in the Health and Human Services Committee, said that she wasn't happy with the way that the allocations were, sort of made. And she wanted to have her own hearings in Health and Human Services. And really, that was just a setback. It was, as you heard Chris say, it was really lip service. It was saying like, wait a minute, the commission that was comprised of professionals and people that were really dedicated, we took it really seriously, met for over 17 hours in a very short period of time. We only had a few weeks in order to do these meetings and put out our recommendations, and we took it very seriously. And so I think it was really disappointing to hear Senator Michelle Brooks say she wanted to conduct her own hearings on the allocation. Regardless, those hearings never took place. And as you heard, when the initial budget was proposed, that $100 million was reallocated by my Republican Senate counterparts to go to school-based mental health funding. What they said at the time was, because ARPA dollars have to be spent, those federal dollars had to be allocated by a time certain or we would lose them. They wanted them to go to school-based mental health. And then we would find $100 million somewhere else later on down the line where we could discuss more how we wanted to allocate it effectively for adult behavioral health. To me, the proposition that this was either or is really so disingenuous. Our Pennsylvania budget and finance office has told us we are sitting on close to a $14 billion surplus, billion with a B. Allocating $100 million to school-based mental health and $100 million to adult behavioral health is something we absolutely could have done. So this was once again, really just putting roadblocks in the way of progress. And so I'm really disappointed that that's where we ended up. You heard Chris and Nikki talk about the governor's Behavioral Health Council that he's putting together under his administration. That's going to be 33 members from across the spectrum, government agencies, providers, legislators. There will be members of the public. I don't think it's enough. I think it's only 2 members with lived experience. So of 33, only having 2 voices with, lived experience isn't enough. So I'm hopeful that some of the other members that are participating in that council will also have lived experience. I have been asked by Senator Costa to be the Senate Democrats' appointee to that council, so I look forward to the work that we'll do ahead. And that council is going to be led by Dr. Christina Finello. Many of you may know her. She is from Bucks County. She has been a mental health advocate for many years. She's a lawyer. She's a social worker. She is somebody who is really educated in this field, and I'm really excited to have the opportunity to work with her. But again, as Chris and Nikki said, this doesn't speak to funding. Funding is our problem here. We know that there is a mental health crisis. We have identified this as an emergency. We know that we have systems that we could be putting into place that would really help to impact the need on mental health services across our Commonwealth, and we're simply not doing it. You heard about 988. 988 is really something that could be an incredible tool for us to use here in the Commonwealth, especially when we hear about reports of 911 calls being made where de-escalation for mental health crisis is really what's necessary, not law enforcement intervention. We really do need a viable alternative to 911, and 988 could be that if we could pass the funding mechanism for it. You heard there's a House bill version. There is also a Senate bill version. Pat Stefano is the prime sponsor of that. So I'm hopeful that there will be some movement on funding that in the near future, but I can't guarantee it. You also heard that the fiscal code that we still have, that we're deciding whether or not we're going to be voting on any day in the Senate, does reallocate that $100 million for behavioral health funding back to adult behavioral health instead of that school-based mental health. I think it's going to be really a game of ping pong, and I really do think our Republican counterparts will strip that out and return it to school-based mental health. That is what they've agreed to, and I think that's what they're going to go back to, which leaves Representative Schlossberg and I still fighting for the viability of our bills. And so that's really where we're at. I do want to talk a little bit about some of the other bills that are, in play here, because there's a lot of really good legislation. I did a search this morning and I just put in mental health as my search term. And I just limited it to this year's session, 23-24, and I only limited it to bills, not resolutions, not co-sponsorship memos, just bills that have been introduced. And I had like 12 pages of search results from House and Senate bills. So I'm just going to highlight a few of them that I think are really interesting for us to talk about. One of them is House Bill 231, Carol Hill Evans. She has a bill that would require post-conviction review for veterans with PTSD. So that would allow incarcerated veterans that are diagnosed after imprisonment to apply to the court for relief, putting forward their diagnosis of mental health disability that they sustained during or as a result of active duty or military training to be a mitigating factor in the crime for which they're charged. And, we really do make a great effort in the legislature to weigh the concerns of victims, the concerns of public safety, and the concerns of the person who is being accused of the criminal activity. And so this is an opportunity for us to really take a step back and say, hey, we need to be really much more mindful and careful when we are diagnosing and sentencing veterans who have been accused of criminal activity. So I think that's a really important piece of legislation. Senate Bill 886, that is a John Kane, Judy Schwenk bill, helping our students achieve by creating student mental health days. They plan to model this after legislation that has been passed in 2 other states, Oregon, and I think Washington State. I don't want to misspeak, but it would allow K through 12 students to take excused absences to help them treat and recover from mental health issues. Right now, those are unexcused absences and they count against a student's school days in the classroom. And so this would really give students an opportunity to address those mental health concerns that we know are really, some of them are skyrocketing, especially post-pandemic. Senate Bill 874, a Jimmy Dillon bill, would be loan forgiveness program for mental health, intellectual disability, and drug and alcohol treatment professions. Senate Bill 178, that is Senator Bartolotta's bill, a mental health treatment database that would include contact information, descriptive details for participating psychiatric facilities throughout the state. It would also provide real-time information regarding the number of beds available at each facility. You heard Chris speak of ER admission. You heard that when someone is in crisis and they go to the ER, often our emergency services providers in the ER don't have a placement. They don't have a behavioral health placement for that person that's in crisis. This would allow them at least to be able to go and take a look at what is available across the state. Not ideal to have somebody be, hundreds, 10s, 20 miles away from family members. But if we can get them into a facility that's really going to be able to treat them effectively, that's got to be our first goal. And this would be a good first step to that. Senate Bill 22, that is Senator Hughes's bill to provide social media protection for minors. Yes, they are related. I think we all can sort of have a sense of how our minors can be targeted on social media and suffer significant mental health repercussions for that. I was reading something this morning, actually, where people were commenting on an article and they were saying, at least, when I was going to school and social media wasn't around, bullying ended at the end of the school day. Now, bullying follows students home through social media. So this would be an opportunity for us to provide some protection for minors. Senate Bill 962. This is a Senator Laughlin and Anthony Williams bill that would create pathways to rehabilitate individuals suffering with substance use disorder. And this is not a bill that I personally would support, but why I bring it up is because I want to show you that there is bipartisanship here. Senator Bartolotta is a Republican. Senator Laughlin is a Republican. And the point of that is to say that there are members of our legislature on both sides of the aisle who recognize that mental illness is not a partisan issue. We have to make sure that we are really sort of pushing that expectation of them, that we are saying when a crisis occurs, it does not matter if that person is a registered Republican, Democrat, Independent, that person deserves every opportunity to get help. There are bills in our legislature to require parity for medical health care insurance providing mental health, physical health and mental health on the same level. I'm sorry, I'm talking fast because I know my time is running short, but for us to be able to say, when you break a leg and you go to the emergency room, there is a certain procedure we follow to make sure that your leg is set, that you get the proper rehab you need, that you spend the night in the hospital if necessary, and that you go home on the medication and rehab services necessary to get you back up and walking. There's no reason that insurance providers should not be required to treat mental health with the same parity, to allow us to properly and effectively treat people with mental health concerns. So I'm going to end it there. I know I said a lot of things and I talked really fast. I'm sorry, but I had a lot of information I wanted to get out. But I'm happy to answer questions, and I'm really happy to just sort of sit back and listen to us talk a lot about why it is so critical that although mental health is not a partisan issue, we do have to change the makeup of our legislature if we intend to see results from all of these incredible bills that I have spoken about, and if we intend to see funding that is so critically important that Chris and Nikki spoke about. Thank you. Thank you, Christine.
Always, Senator Collett. And what we're going to do is, Tiffany, before we send out our follow-up to this particular call, we'll go back to our friends at NAMI and ask them what you'd like to see people do. A couple of people have commented, they've got Republican legislators. What do? You write them, you call them, you make life difficult for them, and you do whatever you can. And so we'll highlight some of the issues that Senator Collett also raised as potential laws. So we'll get you more information so you can take action. One of the things that Senator Collett said that it's kind of okay, I'm very partisan. I got it. I'm very partisan. That's a real bugaboo of mine. She mentioned a bill that Senator Bartolotto and Dan Laughlin are putting forth. Well, this is their caucus. And if the Democrats, the Republicans run the Senate caucus. And so if these were very important to them, why aren't they getting it through their own caucus? And I look at some of these, just like, Senator Laughlin is from Erie, and he keeps tweeting about the need to raise minimum wage. Well, the bill to raise minimum wage has been passed by the House and it's held up in the Senate. And if he thinks it's that important, why isn't he lobbying his caucus to get it done? And so that's the way I feel about some of these. I know it shouldn't be a partisan issue, but the Republicans control the Senate. And if they really are committed to some of these things, why aren't they getting it through their own caucus? My question. So, but we will go through, we'll see if there's any other questions that people had, and we'll make sure that we answer them in the chat. But my own feeling and the feeling of the Represent PAC is we have to change the players. These are really important issues. They've been important issues for decades. We can have all the commissions in the world, but if they aren't funded, it doesn't count. All it does is continue. We're really good at stating the problem over and over and over again. But if we don't make change, we're not gonna change Pennsylvania. We're not going to change who can get guns. We're not going to change the support people get. We're not going to have funding for things. We can have all the commissions in the world, but without funding and teeth, nothing is going to get done. So I would like to completely thank our speakers today. Is there anything else, our NAMI reps or Senator Collett, you want to add at the end here?
I want to thank everybody for being interested enough to spend your mornings talking about this. We have to continue talking about mental health, behavioral health issues, because that is really the way that we raise awareness in our communities, among our family members and friends, and we really get people comfortable with talking about where the need is and what we expect and require of our legislature in order to fund greater services to our Commonwealth.
Thank you. And one of the things that's been very interesting in the chat is the number of our listeners today who are actively involved in this effort because they have family members who are affected, because they know people who are affected, or because they're caring individuals who want to change Pennsylvania. And yes, somebody asked about the the video from this, we will, as part of our follow-up, send it to everybody who was registered for this call, and we ask you to share it with your family and friends. It's so important, and we're so grateful to our friends at NAMI for putting together the lay of the land for us and helping us to understand what's going on. And Senator Collett, we're always in awe of your efforts in this area as in many others, and we're so grateful to have you in Harrisburg. Let's finish up, Tiffany. Keep showing this one. 2023 is not an off year. We're trying to raise money. We're trying to give money so that we can give $1 million. We did $700,000 last cycle, and we want to increase it. What's our goal? Our goal is to that 102 versus 101 is a really tight majority for Speaker McClinton to have in the House, and we need to increase that. We talked today about within our majority in the Senate, over 100 bills have been passed by the House and are getting nowhere. That we don't have budget items for many important issues in the Commonwealth today because they're being held up by the Senate Republicans. We need to make change, and we can do it. It's going to be tough, but we can do it. By the way, what's our process? You know, we hand out money as soon as we can. Remember the original definition of Emily's list? It was started as early money is like yeast. And that's follows that same philosophy. Whatever money we've got in, we'd like to start sending it out. We also don't think that the 6 or so people on our executive committee are the ones who should make all the decisions. So anybody who invests $1,200 a year or more can help us set our endorsements and our endorsement policies. We're having a Zoom meeting on Sunday, November 4th. Yes, I know the Eagles are playing at that time, but we're having a Zoom meeting on Sunday, November 4th to discuss our past donations, our victories, and how we can raise and allocate funds in the next year. We need other people's input. We need to know what to do. Invitations to this meeting have been sent to the people we think are at the $1,200 a year level. If you think you can qualify and haven't received an invitation, contact us. Sunday, November 5th is this Sunday. Is that the 5th? Did I write down the wrong date on my slide?
It's the 5th.
It's the 5th. My slide is wrong. The Eagles are still playing Sunday, November 5th from 4 to 6 at that time. But if you think you have qualified but you have not received an invitation, let us know, because we'd love to have you join us. As I said, we're going to go through where we've allocated in the past, what the timing has been, how funds have been received in the past, and what we want to do over this cycle. The other thing you should know is that if you want to increase your contribution for 2023 in order to join us on that, no problem there. Just contact us, increase your contribution, and we're happy to have you come and help make history. Email us, talk to us, let us know what you're thinking. I keep trying to remind people, one more cycle. We've been at this, Representative's been at this over 10 years. One more cycle. With this cycle, we can flip 3 more Senate seats and put Senator Collett as the chair of the Health Committee. I've decided that's you can pick which committee, but I think you should be chair of the Health Committee in the Senate. You heard her talk today. What a difference it would make to have her clear voice, her knowledgeable voice as head of that committee. And we can make that happen. We can be part of it, but we can make it happen. Because we just need to flip 3 seats to get to a tie in the Senate representation. And with a Democratic lieutenant governor, we will take the lead in the Senate. And Senator Collett can direct these efforts in the Senate Health Committee and get things through. And then we will, since we already have Democratic chairs in the House side, we will have what's known in the vernacular as the trifecta. We will have a Democratic House, a Democratic Senate, and a Democratic governor. And somebody just wrote it in there, and I agree. Wouldn't that be excellent? My role model these days is Michigan. They have a really, really tight trifecta, but since they did it after their last election, they're making a huge difference in what's going on in that state, and we can do it too. One more cycle. Join us, give to us, and let us know what this topic was. Received a lot of interest, and we're so grateful to the speakers we had today. And we look forward to hearing what else you'd like to hear us talk about. Thank you.